It's our immense pleasure today to welcome Dr. Morgane Gourlaouen. Morgane, hello.
Hi.
Hi, can you hear me? Hello.
Yes, I can.
Lovely to have you on board the ISNTD Connect series. Morgane, you've recently published a paper that you will, and some research that you will be speaking to us about. And this work actually has been really fascinating. Unfortunately, rabies continues to be prevalent in a lot of very impoverished regions around the world. We're looking at about 150 countries worldwide. And despite a lot of preventive measures, we're still looking at about 9 deaths a minute. So quite a dramatic state of affairs. And your research has been a really beautiful example of not only trying to push the boundaries in terms of diagnosis of the disease in animals, but also a great example of international collaboration and capacity building. So that's really what inspired us to wanting to have you today as part of this series and to speak to our international network. So Morgane, without any further ado, I'll hand over to you to describe a little bit this fascinating work and collaboration between the Istituto Zooprofilattico Sperimentale delle Venezie in Italy, the FAO, and 14 collaborating centers and laboratories across Sub-Saharan Africa. So Morgane, a very warm welcome to you, and I'll hand over.
Thank you so much, Marianne. Thank you very much for this very lovely introduction. It's a real pleasure to be here with you and all of you connected to follow this presentation today. Thank you for taking the time, and we know that this is a very, very particular situation that we are all facing, but I think it's still very important to carry on our efforts and to keep working on the all neglected disease, and in our case we are talking about rabies. So as you said, I work for the Istituto Zooprofilattico delle Venezie. We are based in Padova, which is very close to Venice, for those who may not know very well. So if you follow the arrow, you can see our building, which is actually brand new. So we can't wait to get back to normal to enjoy these very nice facilities. But I hope that you will probably enjoy the picture below, which is the main square in Padova called Prato della Valle. It's a beautiful place, and for those who have never been yet to this part of Italy, I strongly encourage, once it will be safe, to travel again. But of course, we're not here to speak about tourism. We are here to speak about rabies today. So, as you said, the burden of rabies is huge. We count about 60,000 deaths per year, and the total in Africa is around 20 to 25,000. However, like for all neglected disease, this is known to be underestimated. This number is not correct, and it is a preventable disease. So there is the existence of the vaccine for post-exposure prophylaxis, called PEP also. Unfortunately, and like you can see on the map, it is poor and low-resource countries which are badly affected. Also, notably because the access to the vaccine is very limited and sometimes not even available. So regarding the disease, it can affect all mammals, but we know that dogs are contributing to about 99% of all rabies transmission to human. So so basically, what's important to remember about rabies is that upon the onset of clinical symptoms, it is nearly 100% fatal, and this is terrible because it is actually 100% preventable, given the availability of the vaccine. So regarding the pathogen, rabies is a virus which belongs to the genus of the Lissa virus. It has this very nasty bullet-shaped feature. It is a non-segmented RNA negative strand, and the genome codes for 5 proteins. The pathology in dogs, which is also similar to humans, present 2 different forms. One of them is the furious form, which is the one that most people are aware of. And there is also the paralytic form. And I made here a list of various symptoms, but I'm not going to go too much in details. You can easily read them. But what I want to say is that those symptoms can be also affiliated to other pathology, to other diseases. And in dogs, for example, distemper or infectious canine hepatitis have similar symptoms. And this is very important because it shows that there is an absolute necessity for laboratory confirmation of suspected rabies cases. So showcase initiative basically have shown that the elimination of the disease in dogs is epidemiologically, and it's also feasible basically. So this can be achieved through enhanced laboratory capabilities, improved access to vaccines, of course, enforcement of responsible dog ownership, and also enhanced public education and awareness, which have to be basically worked on together. This is a collaboration. All the stakeholders basically involved in the fight against rabies. We need to all work on those points. Of course, us as a laboratory reference center for FAO and also for national, in the sense for the Italian authorities, we concentrate on the enhanced laboratory capabilities. This goes basically by working on the introduction of adapted protocols, and if they are already in place, working on the harmonization of the techniques. Very importantly, training of the staff. This is a big part of our job, and also the participation of proficiency test, which was basically the subject of the paper we published recently. And all this is extremely, all those points are very, very important if we want to get out of the scheme that you can see here, which is the scheme of the vicious cycle. This scheme is very often seen in various publication or articles about rabies, but this applies to all neglected disease, unfortunately. And it means that basically because we have very little data on the actual burden or the cost of the disease, means that we have no fundings, and because there's no fundings, there is no control and no surveillance, and all of them basically lead to another, and it's very difficult to get out of that cycle. And as Morgane pointed out, we work hard to try to get out of this cycle. So I would like to quickly speak about the trainings on rabies diagnosis that we've been doing over the years across Africa, but actually across the world. We've been working on trainings for more than 10 years. Before I actually was introduced to the team there. And we've been working with 46 countries. Africa, we can count 30 countries. As you can see, more than 260 participants. People came to Italy to be trained at our facilities. More than 250 participants from Africa, more than 20 trainings. And I would like to quickly speak about what we've done recently, because we've been working from remote, of course. So we've been working with the CVL in Paracou, the CVL in Benin. They had already in place the DRIT technique. I will come back on that a bit later. But they wanted to introduce the molecular technique, so they got in touch with us, and we basically helped them, supported them in implementing the molecular detection. They were already applying molecular detection for avian influenza, for example, so they had the equipment and they had the knowledge and the skills. So it was just a matter of implementing the actual protocol. And it was a real success because we managed to confirm by receiving 10 samples from them that they were properly applying both techniques, DRIT and the PCR. And we also got the chance to sequence the virus that were circulating in Benin. And very soon those sequences will be available on GenBank. It is very important when we set up collaboration like this with CVL across the world to publicly to render public the data that is produced, so sequences, and also notification, international notification, which is extremely valuable if we want to increase the data and also the fact that the disease is present in order to get out of the cycle. And then regarding the CVL in Niamey, Niger, we basically help them supplying reagents. So they were struggling with the fact that they could not find a provider for some of the reagent for the immunofluorescence. So we simply worked with them to allow them to get the products. Just to say that all those intervention and supports are just very essential and needs to be carried on. Of course, we work, and you will see also on the proficiency test, we focus principally, my laboratory focus principally on the immunofluorescence, so the direct fluorescence antibody test, which is called the DFA, and the molecular detection by RTPCR. But another test is the DRIT. I will speak about it just now. And this DRIT basically is basically implemented in laboratory by another NGO called Global Alliance for Rabies Control, so GARC. They are based in South Africa, and they are also very present in the field. They do a fantastic work, and as much as possible, we collaborate with them so we can bring as many detection techniques possible to the laboratories. So since 2018. The OIE manual of diagnostic tests and vaccines for terrestrial animals included the DRIT and the RT-PCR as gold standard. So before that, so until 2 years ago, the immunofluorescence, which you can see, this is the picture on the left, was the only gold standard. But this is not the case anymore. And now the DRIT, which is the picture on the middle, and also molecular detection, the picture on the right, are now recognized. It can be safely applied, basically, by the laboratories. They work in the detection of rabies virus, of course, but the DFA and the DRIT work in detecting the viral antigens, whilst the RNA, the viral RNA, is detected when you use the RT-PCR. Someone could ask, why would you want to implement different techniques? Because of course this is more work. But actually, by having more than one technique, it means that you also increase the chance to detect the virus. So it is actually quite important to have the DFA or the DRIT. They work the same way, and also on top of that, access to molecular detection. This also means that you can adapt based on the diagnostic resources, which can be, of course, human expertise, the type of trainings that people have received, basically, or the equipment which is available. And very importantly, we have seen over the years with the collaboration of the laboratories that we have, that unfortunately failure of equipment can happen. And if you have another technique available, this means that, for example, if your microscope breaks down, you can rely on another protocol, and there won't be any break in routine diagnostic, which is unacceptable in countries where rabies, especially in countries where rabies is endemic. So I hope that you will understand that our aim is very much to implement and support rabies diagnostic to as many endemic countries as possible, and we do so by collaborating with as many laboratories, of course, and also with other organizations, international organizations, to reach this goal. So a proficiency test, basically in general, but for the diagnosis of rabies, aims firstly to test for the diagnostic capabilities, and you will see our study focused on the immunofluorescence and on the RTPCR. But then this proficiency test was also an opportunity to update the vaccination status of the laboratory staff. It was also a way to harmonize the techniques adopted by the laboratories. It was also a way to speak and remind people about safety and biosecurity rules related to the diagnostic of rabies. And it was also an opportunity to collect information related to the laboratory practice and activities. And we also were able to bring technical assistance, of course, when it was required. And very importantly, to introduce a molecular protocol for the diagnosis of rabies. Indeed, we were able to implement that protocol in 8 out of the 14 participating laboratories. And just to say, the laboratories that were already applying this protocol were applying the same protocol that we were recommending basically. So the general organization was that originally 15 laboratories were involved in the project. You can see here that Sierra Leone is also colored in red, but unfortunately they were not able to receive or perform the proficiency test because the laboratory is still under renovation. So we are very, very much hoping that they will be able to participate to the next PT. But it was basically 13 central veterinarian laboratory and 1 public health institute that took part to this program. So we basically sent the invitation letter to all the directors, laboratory directors, and we did so on the 28th of September. So for those who are part of the rabies community, this basically celebrates the World Rabies Day, so it's a very important day for us. This was in 2017 also. And those emails and all communication were also closely followed by all the country team leaders from FAO and the regional lab experts from FAO as well, from West and Central Africa. So we provided instruction for rabies sample handling. We also provided, of course, the protocol for the conventional RT-PCR. And we also gave a list of reagents, and we did so because it was important that laboratories in countries basically where shortage of reagent can happen would have the time to prepare and make sure that they had everything to perform the exercise. We then verified, as I mentioned before, the vaccination status, and it was quite important because we realized that 5 out of 14 laboratories actually did not present satisfactory vaccine coverage. So that's almost 36%. And of course, we encouraged those laboratories to vaccinate the laboratory members. This was absolutely done. It was for us impossible to ship material which is susceptible to be contaminated, positive for rabies, to be shipped to laboratories where staff may not be fully protected. And then we also organized a webinar. This was organized, basically co-organized with FAO lab unit in Rome, and in particular with Angélique Angot. And we basically, during this webinar, we explained why it was important to participate to proficiency test, how also, and it was this way was also possibility for us to remind on the biosafety, biosecurity, which is essential. So laboratories basically were invited to perform the proficiency test, to test the PT samples using the tests routinely applied, all of them except for one, basically applied already the fluorescent antibody test. And of course, for those laboratories who did not yet perform the protocol for the RTPCR, this was for us a great way to test whether the implementation was done, was correctly achieved. So each participant received the same panel of blind coded sample to basically be tested. I would like to quickly say that if you follow basically the ISO 17025, which is the accreditation for diagnostic testing laboratories, it is mandatory to participate to proficiency testing programs, just to highlight how important it is to have a regular exercise such as the one I'm talking about. So the samples were shipped basically according to very strict regulation, because they have to be shipped on as dangerous goods on dry ice. And we also included in the parcel this little strip that you can see here, time stream plus, which help us to control that the temperature, basically the temperature was maintained during the shipment. On average, it was 11 days, and you can see here Ghana was actually 50 days. We had a problem. The parcel was blocked at the border for basically almost 2 months, but fortunately there was regular dry ice refill, and we know also, because we perform frequent stability tests, and in our hands we know that up to 1 year after preparation of the samples, stability is still integrated, and basically samples are fit for purpose. And then finally, upon reception of samples, laboratories had 4 weeks to perform the PT. So the panel composition was basically 5 positive samples, 4 of rabies virus, and 1 African bat Lissa virus, and 5 negative virus, including 1 sample which we had decided to spike with synthetic RNA. The reason why we did that was basically to mimic what happened in a carcass in decomposition, or a petrified brain sample that often can reach the laboratory. And so for those who may not be too familiar, what happened is that in a compromised sample, the virus is not alive anymore. And because the DRIT and the DFA detect the antigens, the detection of antigens in those samples becomes very difficult. However, it is still possible to test for the presence of the viral RNA, and therefore the protocol for RT-PCR can still detect whether those samples were positive for rabies. So this is the reason why we chose to set up such a sample. So regarding the results, the performance of the African laboratory for the DFA was actually in agreement with other studies that were published, notably by ANSES, of proficiency tests that took place in Europe and North Africa. And as you can see, the sensitivity of the fluorescent was 90%, and the specificity was 86%. So I invite you to consult the last lane of the table. It is quite important to say that in agreement with other studies, because for many years this sensitivity and specificity and still nowadays is considered as very satisfactory. However, we know that sometimes people that may be out of the field of rabies may consider that maybe this is not high enough, but however, it is considered as satisfactory. The fluorescent antibody test is a very very good performing detection test. So the result for the conventional RT-PCR here I wrote was excellent, because it was really excellent compared to other studies. We were thrilled when we analyzed the results, because we reached 100% specificity and the sensitivity was of 96%. So this really showed that basically the laboratories already applying the test applied it well, but very importantly the laboratories implementing the test were able to implement it very well. So this is extremely encouraging, of course. And regarding the performance of the diagnostic test applied, so both the immunofluorescence and the RT-PCR, here the RT-PCR shows a higher agreement than the DFA test. However, I really want to say that this is not an advocacy for one technique over another. They complement each other. RT-PCR is not there to replace immunofluorescence or DRIT. They have to be used together in parallel when possible, of course. And also this is in agreement with other published studies. So there is nothing new here. Then I would like to quickly speak about the information that we were able to collect on the sample analyzed by African laboratories. And as you can see here, we basically asked them to give us the amount of samples that they receive over the year of 2016 and 2017, and to give us also the proportion of positive samples. And as you can see here, at least 60% of the samples that those laboratories receive are tested positive for rabies. It is huge. It's very high, and this is very important, because this shows that the vaccination status of staff must be regularly updated, because given the proportion of positive sample that they test. So the conclusion and achievement and also way forward, what I hope you can take out of this work and this presentation is that, of course, a vaccination status is primordial in this work. That 12 out of 14 central veterinarian laboratories succeeded this proficiency test. This is very high, and this is very, very good. There was a successful introduction of molecular testing, and also that the samples that were provided are now can now be used basically either for routine diagnostic as positive and negative control, but they can also be very useful for the validation process. You can also appreciate that there is a need for an enhanced application of quality assurance protocols, and also participation to basically yearly exercise, yearly proficiency test. And finally, last but not least, is that the trainings and the collaborative efforts that were done over the year by the different organizations working in the fight against rabies basically are proven extremely successful, and that African laboratories basically, given the fact that they do not have a lot of mean, still apply very well the protocols and detect correctly the samples that they receive, and this is probably the most important point. So I will finish because I can see that I'm already running out of time. I would like just to thank all the collaborators and the lab members, our colleagues from FAO, without whom this work would not be possible, Angélique Angot and Christian de Battisti, all the team basically, USAID for the funding, the people at my institute, of course, Paola, with my supervisor, Francesca, Stefania, and also Barbara, who did a fantastic work, and all the participating laboratory across Sub-Saharan Africa. Thank you very much.
You've had a lot of questions on the chat in the meantime, on all sorts of levels. First and foremost, I'd like to just point out that completely coincidentally, Morgane and myself, we are both French. We have a lot of francophone attendees, across your partners and as well as outside of that circle. So I think for the rest of the discussion, we may have to have a bit of a bilingual thing going. So first and foremost, I'll swap over to French for a few seconds and say merci beaucoup à tous ceux qui se sont joints à nous aujourd'hui, qui participent. Désolé que nous n'avons pas pu vous envoyer ou vous avoir une séance en bilingue, en français et en anglais, mais on va essayer de travailler là-dessus. Mais en tout cas, salutations à vous. Merci beaucoup de vous être joints à nous. Morgane, you've got a really international audience today. I just thought I'd say a quick hello to some familiar names who've connected during here. Dora Rajohnson's tuning in from Bangkok. Hello, Dora. Garmi Vupawi from Liberia. You mentioned familiar faces. You mentioned Angélique from FAO headquarters, I'm assuming in Rome.
Absolutely.
Gabriel Lang and Bruna Amaral from London. Hello. And we've got as well Selvi Subramaniam saying greetings from Kuala Lumpur. Jacqueline Lichotti, hi everyone from Sierra Leone. Et bonjour à vous, Mohamed Amada Diakité et Kouramoudou Berete du Mali. Bonjour.
Ah, bonjour.
Eh oui, tout le monde est là. Bien, so hello to all of you, and I'm sorry I couldn't mention everybody, but we're really pleased you're here, and thanks for connecting. So moving on to some of the questions that you've had, Morgane. Let's start, perhaps this one is going back a bit towards the start of your presentation. We've got a great question here from Olivier Espace. Olivier is speaking from SIVA Santé Animale, Public Affairs, Director, and asking and commenting, Morgane, I agree that the lack of credible burden data is a huge obstacle to funding, and I could touch this problem, for example, in our dealings with funders such as the Gates Foundation. And what are your thoughts on this?
Oh, okay. It's a very good, very vast question also. Well, on this, we believe that even though the the amount of data is still quite limited. It is very important for it to be transparent, and this is why we strongly encourage for notification. We strongly encourage for publication. So, for example, I'm thinking about the bulletin for rabies, bulletin for rabies, which basically shows per country's data that was accumulating within the Resolab of the amount of positive samples, of sample received first and positive sample that were analyzed per country per CVL, but basically to get out of the limited amount, we need to increase the testing and increase the transparency and communication of data. I mean, at least that's what I believe.
Fantastic. Jacqueline Lichotti from Sierra Leone was just commenting that Sierra Leone started testing for rabies using FAT. Are you in a position to supply positive control? And also, would Sierra Leone be included in the next proficiency testing cycle? I think Angelique replied part of the way on the chat about this point, but Morgane, perhaps you have some thoughts on expanding the network and maybe what your next steps might be.
Absolutely. So, of course, I mean, unfortunately, like I said, because there were some renovation, it was difficult for us to ship material, including positive control to Sierra Leone. But this is absolutely something that should be including in the activities that we will have in the future. And Angelique, our colleagues in FAO, will confirm that. But I believe that yes, Sierra Leone should be included also in the next proficiency test exercise.
Brilliant. That's great news. And there was a couple other comments which are sort of around the same topic and theme. Francis Inagolatolaki, a veterinarian in Uganda, was asking, Dr. Morgane, first of all, your presentation is really excellent, providing me with great insights. However, the lack of laboratory capacity for rabies diagnosis and poor exchange of information across veterinary and medical experts is evident. What is your opinion on having a combined human and animal rabies diagnostic facility? And kind of on the same theme, Gabrielle Lane was asking, were the laboratories offering rabies testing for both human and animal samples? And if so, was this a new change, or are most laboratories already offering services for both humans and animals?
Okay, so I guess this question also, of course, is in Africa. So there's two different parts here, I guess. Of course, the first one is that the One Health approach, which have been developed over the past few years, aims to improve, introduce and improve, if it's not yet introduced, a better communication between the different services or the different actors in the rabies fight, given the veterinarian part and also the human part as well of course, of all the actors regarding vaccination campaigns. All those people have to work and interact together, and I believe that this is what the One Health program is really trying to do and doing, actually, as a matter of fact. Then regarding the detection of of rabies in intravitam, I imagine in human, it is a very complex. It is a very complex question because, as we know, it is actually quite difficult to do so. So far, I believe that in many laboratories with whom we've collaborated, they work on animal rabies, detection of rabies in animals. We have to work very hard so that more samples reach the laboratory. This is the first point. And unfortunately, because many human rabies cases go undetected in many countries, not just in Africa, but in countries where the disease is endemic, this is still, I agree, a very limited. This is still very limited, basically. But absolutely, I mean, laboratories that perform the detection of rabies in animals are absolutely able to, if they receive the appropriate samples, they should be able to perform, and I think notably of the PCR, the molecular detection, they should also be able to perform detection of rabies in human.
Brilliant. And this sort of ties into a question by Louisa Hallmeyer-Wacker. And please don't hesitate, attendees asking questions, to just let us know what your organization is or where you're tuning in from. She's just saying, first of all, thank you for the interesting presentation. And also, if you could elaborate a little bit more on, is accurate sample collection and appropriate storage an issue, well, within certain settings?
Can you please repeat it? Sorry. Accurate?
Yeah. Accurate sample collection and appropriate storage, an issue.
Okay. Whether it's an issue or not.
Exactly. Yeah.
Oh, sorry. I did not get it.
Yeah. Sorry, Morgane. And apologies to everyone. I've had a few comments that I'm breaking up today. So, yeah. Sorry, guys.
Thank you. Well, I will. I will not go in too much detail, because at the end, regarding the sample collection and sample storage, for more detailed information, because this could be actually a whole training session. There is. I invite people basically to consult the OIE manual of diagnostic test and vaccine for terrestrial animals. If also necessary, I can forward the PDF to this person. I can't remember the name. But if we are talking about animal, it's the OIE manual. For the human sampling, the WHO manual, there is a recent WHO manual that was released, I believe, last year, 2018 or 2019. Sorry, I've got a doubt now, which is absolutely fantastic and details very, very well. Of course, regarding the storage of sample, it is recommended to keep sample in the freezer. So minus 80, to go in a bit more detail. If sample cannot be detected straight away, of course, if laboratories only have access to a minus 20, then it will be minus 20.
Brilliant. We had a question here from Varni Kamara from the University of Hawaii. Diagnostic of rabies is usually done at post-mortem. Are you working on a diagnostic method that can be used on live animals?
No. I mean, my answer will be no. We are not. Like, the idea is that, of course, the detection of rabies before the onset of symptoms is not applicable. It's not done, and it's true that in animal we speak about post-mortem analysis. So at this moment in time, I don't want to go too much into that. I know that some people try to do it on the saliva of some animal, for example, of dogs, using rapid test. But I actually believe that the results have not been not been acceptable, let's say. So at this moment in time, no, we concentrate on implementing the gold standards, and this is our main focus.
Brilliant, thank you for that. A question from Frederick Lohr from Mission Rabies. Hello and thank you for the great presentation, and hello back, Frederick. Nice to see you again. On the note on increasing data from the field, What are your feelings about lateral flow devices?
Thank you. Well, I was just talking about lateral flow devices when I was talking about the rapid test. It is, well, at this time we agree this is not a recommended test. So we do not, we work on the test recommended by the OIE. Of course, we've done different studies using the lateral flow device. And recently, very soon, they should be available on the Journal of Video Experimentation, experimentation job, a study to which we participated, describing a basically updated protocol for the use of LFDs. We believe that using this protocol, the detection is actually much better than the one that is used by the manufacturer's instruction. I believe that people familiar with the lateral flow device will understand what I mean. But of course, very importantly, and I really want to insist on that, is that this looks like a very promising tools. The field, the science field, everybody will know that is constantly growing, updating. The idea is to bring to the people the best test possible, but at this moment it's still not a recommended OIE. So we believe it's promising, and we would not leave it out, but we do it also very carefully.
Brilliant. Morgane, we're kind of 45 minutes into the discussion. I was just wondering whether you would have a few more minutes for a couple more questions. You've really elicited a lot of questions and comments there, so definitely a good discussion going on. It's entirely up to you if you've got a few more minutes to answer.
It's a pleasure to be here and to interact with all the participants. So yeah, I've got time.
Brilliant. Okay, then I'll move ahead with Dora's question, Dora Johnson. Do you think that the rabies vaccine characteristics might be also a cause of limitation for the rabies disease elimination? Because if my memory is good, the vaccine requires 3 doses, 3 injections, in which the last injection has to be repeated every 5 years. And also, if it is not that affordable for all the population, that's also a problem. For example, in my country, Madagascar, and that's also a point which has been raised by Winifrida Mponzi from the Ifikara Health Institute in Tanzania. What are some of the reasons for which rabies vaccines are very expensive? I notice some of the people, especially in rural settings, cannot afford it.
Absolutely. It's very true. This also explains, of course, why poor and low resources in countries with poor and low resources settings, access to vaccine is difficult, given the fact that even if you can afford 1 dose, maybe you cannot afford the second or third dose. Although, of course, I'm not an expert on the vaccination. I don't have the pretension. I'm not an expert on that, but I believe that the WHO did some revision of the vaccination for rabies. All the precise information are available online. So I would invite that person to consult this. Nevertheless, of course, like I said in the beginning of the presentation, because we know that access to vaccine can be limited, it is therefore important to prevent human dog-mediated, human death, is to basically increase dog ownership in increasing the vaccination of dogs, access to dogs vaccine campaign, because the idea is that if more, of course, we reach this 70% coverage of vaccination in animals, then we can basically stop we can basically stop dogs in human. Of course, then the fact that the human vaccine is not always available, the fact that it has to be refrigerated and not for more than 24 hours. Sorry. Basically can lead to loss of batches of vaccines. So yes, all those reasons means that we have to work also on the limitation of rabies in dogs by vaccination plans, of course, in dogs, increasing of diagnosis in the animal when they start presenting symptoms, of course, in order to work basically as much as possible in limiting the disease.
Wow. It's really interesting. Shall we take a question in French, Morgane?
Yeah, of course. Bien sûr, bien sûr, bien sûr.
Ok, on passe au français. Une question de Kouramudou Beret. Salut, docteur Morgane.
Bonjour.
Bonjour. Est-ce que le test DRIT est maintenant recommandé? Merci pour cette présentation. And it was quite a straightforward question, but just translating in English, Dr. Kouramudou Beret is asking, is the DRIT, D-R-I-T, DRIT test now recommended?
Merci. Déjà, bonjour Vérité, j'espère que vous allez bien. Nous avons fait un training ensemble il y a quelques... c'était l'année dernière. Et oui, le DRIT est recommandé depuis 2018. Le DRIT et les tests PCR moléculaires sont recommandés, font partie du manuel de l'OIE et donc en fait peuvent être utilisés au même titre que le test d'immunofluorescence. Est-ce que tu veux que je fasse la traduction en anglais?
Eh ben, si tu veux, oui, ok.
No, so I was just answering that like I was showing on the presentation that since 2018 the DRIT test has been recognized by the OIE as a valid as a gold standard for the detection of rabies in animals, of course.
Brilliant. I think we've got time for one last question, and perhaps after that, a few of your thoughts on where you would like to see this research and this network moving towards in the future. Are there certain partnerships that you're looking for, or further funding opportunities, etc.? But first, I'll share a question by Tabenzia Wekesa. Morgane, is it possible to have the PTs programmed, for example, on a biennial basis, once every 2 years?
Once every 2 years. Okay. So I believe that this is that this is possible. Yes, absolutely. In the sense that if a laboratory shows, for example, that it can only participate to a proficiency test once every 2 years instead of once every year, this is still a very good effort. This is still a very good exercise, and I believe it is possible. Absolutely.
Brilliant. Since the last question, you've had again more questions. So perhaps we'll take this the very last one from Helena Uliartha, Ministry of Health Indonesia. Hello, Helena, nice to see you again. Thanks for joining us, I think, on every session. Helena was asking, I just missed that. Did you experience using the mouse inoculation test? And what is the most urgent effort to deal with elimination?
Yes, so the MIT, so mouse inoculation test, the MIT is actually not recommended anymore by the OIE. So it should be replaced basically by one of the gold standards, so the DFA, the DRIT, or the RTPCR. Also, given the fact that we have to, in order to ethically limit the use of laboratory animals, but also because it's a very long test. So the mouse inoculation test is, of course, and we have to say it's used for research programs, or if, for example, some viruses need to be replicated, and this is the only option. But in terms of diagnostic, these techniques should not be used anymore. And then what was the second part of the question? Sorry.
In your opinion, what's the most urgent effort to deal with elimination?
Yeah, okay. Well, I guess, I mean, this this seems a bit easy to answer, but all the efforts have to be put. I mean, all the efforts have to be done together if you want to achieve the elimination of your, you know, human death caused by dog rabies in 2030. So, increasing the laboratories' capabilities, increasing the awareness, increasing basically the access to vaccination, dog vaccination, all those actions have to be taken all together, I believe, if we want to reach that goal in about 10 years now.
And I guess that also echoes very much the messages that underpin the WHO's new roadmap for neglected tropical diseases in general to 2030, which is really looking at reinforcing and strengthening those health systems as a whole. So kind of a very joint approach to any form of
Absolutely. Well, I guess also this goes with the One Health approach. I mean, at the end, which is very, very, very essentially important, and efforts needs to be done jointly all together. Absolutely, I agree on that totally.
Well, Morgane, yourself and your team of collaborators have, I think, shown us the way forward. Definitely, you're a great ambassador for this kind of approach. So we're very grateful, learned a lot from you. And so just kind of as concluding words, having worked on this project for quite some time, what would be your ideal next steps or any partnerships you're looking for? How would you like to see this evolve over the sort of short and medium term?
Well, it's it's a very, very vast question. Well, our aims basically for the future are, of course, to carry on what we are doing in the sense trainings, improving the access to diagnostic techniques to the laboratories based on what they can. We are a FAO reference center, so we work closely, of course, with them. The project that are basically developed and funded with FAO colleagues, which are basically mostly based in Africa, and yeah, we basically, of course, I guess our main aim is that we want to render the helping and reinforcing laboratories is very important, but it's also important that this becomes sustainable, and that rabies diagnostic facilities basically have a similar rhythm to the one that, for example, my laboratory can have. So I guess this is the efforts that we want to put into the following years.
That's brilliant, and we'll be there to watch this space and also, you know, share and echo all the messages on World Rabies Day that you mentioned. And you know, let's definitely keep in touch, Morgane. I think you've had a lot of. It's pretty evident from the chat you've elicited a great discussion, and I'm sure a lot of people would like to get in touch. You know, this. Morgane and I kind of came in touch because recently there was a paper, you were the lead author on this, that was published in ISNTD. So if you would like to read that or find out a little bit more detail about what was discussed today, I'm just going to share the PDF. So it should now appear hopefully on your screens. Please feel free to download that and also to contact Morgane for any more information or details. One of the things we discussed with Morgane along the way was that given this current situation with the lockdowns that we are facing, it is sometimes a little bit difficult at the moment to share any new research. So again, I would like to repeat, you know, we would love to have any of you on board. If you are thinking of publishing anything or there's a project you'd like to share with our network, please don't hesitate to get in touch. Would be lovely to have you on board as a speaker. So I think, you know, it was great to get to know you more, Morgane, and I hope that you will inspire lots of other researchers to step forward and join the ISNTD Connect series. And all that's left for me to do is to thank you once again, Morgane. Lots of people thanking you again also on the chat. Stephen Maud saying, great chat, really enjoyed that, and thank you for your great efforts. We've had another thank you. Jacqueline Lichotti, thanks for the presentation. Terence Scott, well done, Morgane, great presentation. Varni Kamaras, leaving us with the thought that there are lots of questions to answer. So overall, a very big thank you. Nice presentation. Merci beaucoup. Voilà.
Merci. Thank you so much. Thanks to all the participants for following and being there with us. Thank you very much.
Well, thank you too, and thanks to everyone for joining us. We'll be in touch soon. We've got lots of exciting things lined up for you in the next few days and weeks. So by all means, we'll be in touch. We'll share the login details, and we hope to see you all very, very soon. In the meantime, take care. Good luck with everything, and hope to see you very soon again. And thank you, Morgane. And let's keep in touch.
Yeah. Thanks, absolutely. Bye.
Bye, everybody. Bye to all.
Thank you.
Thanks.